Hello everyone, I am Dr. Deepa. Today we will learn about the lymphatic drainage and the applied anatomy of the mammary gland or the breast. We have already discussed about the extent, the structure and the vascular supply of the mammary gland in our previous video. In this video, we will look in detail about the lymphatic drainage and the clinical importance of the mammary gland. Moving on to the lymphatic drainage of the mammary gland. The lymphatic drainage of the gland are of two sets mainly. That is the lymphatics draining the parenchyma of the breast which includes the area of nipple and areola. So they are among the two sets. The first set include the lymphatics of the parenchyma as along with the parenchyma the area of the nipple and the areola. The second set is the lymphatics which drain the overlying skin. So this is about the lymphatic drainage. Moving on to the very first, that is the lymphatics from the parenchyma. The lymph vessels of the parenchyma run along the interlobular connective tissue and also the walls of the lactiferous ducts. From here, the lymphatics join the subareolar plexus of Sape, which is the lymphatic plexus which drain this area, that is the lymphatic, that is the areola and the nipple. And later all the lymphatics ultimately reach to drain into the axillary group of lymph nodes. Yes, the lymphatics from the parenchyma along with the lymphatics of the areola and the nipple drain into the axillary group of lymph nodes by passing through the clavicopectoral fascia. The drainage is mainly into the axillary group of lymph node, which includes various groups as given in this picture. Now this is the picture showing the lymphatics of the areola and the nipple. As I have told, the lymphatics from the areola and the nipple may drain into the plexus, that is the subareolar lymphatic plexus of Sape, which later reach the anterior axillary group of lymph nodes. This picture shows the area of drainage of the parenchymal portion of the breast. About 75% of the lymphatics from the parenchyma reach the axillary lymph nodes, which include mainly the anterior, and a small portion also reach the posterior group of lymph nodes. That is, the lymphatics from the axillary tail reach the posterior group of lymph nodes, whereas major portion of the lymphatics tend to reach the anterior axillary group of lymph nodes. From this anterior and the posterior group of axillary lymph node, the lymphatic reach the central group from which it reaches the apical group of lymphatic lymph nodes. About 20% of the lymphatics, that is the parenchymal lymphatics, are seen to drain into the parasternal group or the internal mammary group of lymph nodes, and around 5% of the lymphatics of the parenchyma drain into the posterior intercostal group of lymph nodes. So this is about the drainage of the parenchymal portion of the breast along with the nipple and the areola. Moving on to the lymphatic drainage from the overlying skin. When we talk about the lymphatic drainage of the overlying skin, the entire skin of the breast, excluding the area of the nipple and the areola, pass in the radial manner and drain into the peripheral nodes, that is the outer part. The outer part of the skin drains into the axillary group of lymph nodes, whereas the upper part of the skin is seen to drain into the supraclavicular group of lymph nodes over here. The inner part of the overlying skin drains into the internal mammary group of lymph nodes, which is also called as the parasternal group of lymph nodes. The cutaneous lymphatics communicate across the midline with those of the opposite breast. This is the reason for the unilateral disease of the breast to become bilateral. This bilateral spread of the disease is mainly due to this cutaneous lymphatics, that is the internal mammary group of lymph nodes which communicate with the opposite breast along the midline. The lower portion of the overlying skin of the breast drain into the lymphatics, which later communicate with the rectus sheath of the abdominal wall and form the lymphatic plexus, which is called as a subperitoneal plexus, which pierces the upper part of the linea alba. These vessels drain into the subdiaphragmic group of lymph nodes. Under the rare occasion, the cancer cells from the subperitoneal plexus may seem to drop into the general peritoneal cavity and undergo the transcoelomic migration and produce secondary deposits in the ovary, which is known as the Krukenbeck's tumor. So this is about the lymphatics draining the overlying skin. I repeat, the lymphatics of the overlying skin is mainly into the axillary group of lymph nodes, that is the outer part of the skin mainly drains into the axillary group of lymph nodes. The inner part of the skin drains into the internal mammary group of lymph nodes, whereas the portion in the lower part drains and later communicates with the rectus sheath and ultimately make up the subperitoneal plexus, which drains into the subdiaphragmic group of lymph nodes. Sometimes the transcoelomic spread of the cancer cells may be seen to reach the ovary, making up the Krukenbeck's tumor. So this is about the lymphatic drainage of the parenchyma as well as the overlying skin of the mammary gland. This is the atlas picture showing the lymphatics and the lymph vessels, as we can make out the axillary tail, that is the parenchyma or involving the axillary tail drains into the posterior group of lymph nodes. That is the major portion of the parenchyma draining into the axillary group of lymph nodes to reach the apical axillary nodes. The inner portion of the breast draining into the parasternal group and the nipple and the areola, which makes up the subareolar plexus of Sape over here. When we talk about the clinical anatomy of the breast lump is seen to be the commonest condition in females. The breast lump may be the sign of the benign condition or the malignancy. If the lump is soft and mobile, it suggests the features of the fibroadenoma, which is a benign condition in case of females, which is mainly seen due to the overgrowth of the lobules. Anyway, the diagnosis can be made by the FNAC, the mammography, or the ultrasonography as well. The breast lump, which has the feature of fixation of it to the breast and which is hard inconsistency, represents the feature of the malignant condition. The malignancy of the breast represents the features like fixation of the breast, the retraction of the nipple, and the pudgy-orange appearance of the skin. So these are the features which represents the breast cancer. The pudgy-orange appearance of the skin is the important condition wherein the hair follicles of the overlying lump appear to be retracted and is caused mainly by the obstruction of the cutaneous lymphatics with the stagnation of the lymph and the edema of the skin around the hair follicle. So this is giving the appearance of the orange skin, hence called as the pudgy-orange appearance of the skin. So this is the live picture showing the appearance of the skin in case of malignant condition of the breast. In unilateral breast cancer, the axillary lymph nodes of both the side should be examined for the enlargement. The secondary deposits on the ovaries in case of breast cancer represents the worst prognosis. The breast lump up to 4 cm diameter with the signs of malignancy is usually treated with the tumor excision with conservation of the rest of the breast tissue. Whereas in case of larger lumps, the treatment is mainly the radical mastectomy, which includes the total removal of the breast along with the axillary group of lymph nodes. The other common clinical condition is the papilloma involving the breast. The blood-stained nipple discharge without the palpable mass is usually caused by the intraductal papilloma, which is the non-malignant condition. This intraductal papilloma is treated after circumareolar incision by the excision of the affected duct in the radial manner. So this is about the papilloma of the breast. So this is the picture showing the difference between the unretracted nipple in case of the normal breast and the retracted nipple in case of the affected breast, that is the malignancy involved here, which is one of the important sign of the malignant condition. So this is all about the lymphatic drainage and the clinical importance of the mammary gland. Thank you.